Let's bring in infectious disease specialist Sumon Chakrabarti. He is a doctor joining us from Mississauga today. Good to see you on this Tuesday, Dr. Chakrabarti.
Great to be here, Todd. Thanks for having me.
All right, let's start with the good news. Case counts are down, and there is some positive news as well on the manufacturing of vaccines in Canada. Of course, we don't have a domestic capacity, or we didn't, but we're now on track to have that, although it's going to be, a year from now.
Yeah, this is good news the way I look at it. And I think one of the big things is looking forward. We've been talking a lot about these reactive policies that have been made, but having domestic capacity is going to be important for us in the future. We do think that we are likely going to require, booster shots for COVID at some point in the future. But there's also other vaccines as well that we need, such as the domestic stuff that we use for childhood vaccinations, even flu vaccinations. So having domestic capacity is important, and this I think is a very forward-looking type of intervention.
But it's not going to do much in the here and now in terms of those vaccinations, which, as you know, and I know you're following the numbers very slowly going up. We're just over 860,000 Canadians now have received their first dose, and we're at about just over 115,000 who have been fully inoculated, Dr. Chakrabarti.
Yeah, this number has been slow and a lot slower than a lot of us would want. Now, that said, I do fully expect this to ramp up, especially next month. When we look around the world, there has been a little bit of tension in terms of whether we're going to get those deliveries or not. But listening to Trudeau yesterday and the day before, he was talking about him being confident that we are still going to get it. We need to get this vaccine into Canadian arms as fast as possible.
Let me ask you as well about the variants, or as some have called it, scariants, people concerned about the mutations. We know that vaccines mutate, it's what they do, but now there's sort of a mutation on that original British variant as well. We've got the South African situation, we've got a variant as well from Brazil. Some of them are circulating in Canada. Whatever numbers we're getting, we know that the reality is there are probably a lot more of those cases that are just undetected at this point.
That's exactly right. The variants are here, and we can do things to mitigate their entrance. But I think that the thing that we really should be focusing on is what we can do to bolster our public health preventative responses, and of course, get vaccines into arms. What we do know is all the vaccine candidates that we have, even with the variants, they take a severe disease and they can make it into a mild one, and they really significantly reduce hospitalizations. That's our ticket out of the pandemic. And I think all these things are important. The variants are important to look at, but we shouldn't lose sight of the tried and true principles of public health and vaccination to help us get out of this pandemic.
The situation with that South African variant, as you know, it's in your area, your neck of the woods. The gentleman in question did not travel and doesn't know of anyone he came into contact with who did, which means that it's out there in the community. It's now spreading.
That's absolutely right. It's in the community. I mean, it's undetected. That said, look, if we look at the grand picture of things, the numbers are still going down. We're still in a relatively good position. I agree. We don't want to be opening up and having, large gatherings right away, but things are looking up and things will get better as 2021 rolls on. So I think that we are in a good position. We have to remain vigilant and keep an eye on these variants, but I think that otherwise the vaccination and public health measures are the emphasis on our response, and these need to continue.
Yeah, I'm glad you brought that up because the numbers are good and they're trending down, and that is a positive thing, absolutely. But is it a potential situation on the horizon in which these variants, as contagious as some of them are, begin to overtake the current, COVID-19 virus that we've become so used to over the last 11 months, that they overtake that and all of a sudden the numbers start to go back up again, Dr. Chakrabarti, in March, April, and May?
Very possibly. One thing we have to remember, though, the difference right now is that we have a vaccine. So if the vaccine is making it so that a tiny minority of people, even less than now, are getting hospitalized and the hospital capacity is otherwise ready, even if a surge happens, then even if we have lots of cases in the community, we don't want to have tons of them, but even if we have that, it's not going to be as big of a deal because we can deal with it. I do fully expect this virus to become more of a seasonal thing. Having cases at all is not necessarily a bad thing as long as we're able to prevent severe illness with vaccination.
Dr. Chakrabarti, appreciate you taking the time for CTV News Channel today. Thank you.